There's a myth, right? That women have loose vaginas because of sex. But you and I know that women get loose vaginas, which is not really a great term, but because their pelvic floor gets weak, right? One is a lot of these women are then being told or, getting other surgeries, right? To then to make things smaller, which can lead to its own problem. But what are your thoughts on that?
The surgeries or all of it?
All of it.
Okay. Yes. Number one, I think there's so many components that come into this. Like if we really unravel, like the quote, lax vagina.
I like that a little better.
Okay.
Loose,
Yes. Right.
That's a better term.
So, we want to consider was there birth trauma, right? That ever happened, right? Was there a tear that happened, right? Did anatomically the structures really change or become dysfunctional? Number two, hormonal status, right? Mm-hmm. So because all of this influences the state of the musculature and the anatomy, right? So then if you're my age, right, and you're in your 50s, and so a lot of women will be like, oh, well, things are just now not the same, right? So they don't look the same. They're not as plump. Well, what is the hormonal status? Because the musculature, as well as like all the vulvar structures, depends on estrogen and testosterone. So if we're losing that, we need to put that back in as well.
Yes.
Right? So I would absolutely want somebody to do that before they would ever opt for some kind of surgery, because if the tissue is already lacking blood flow, dysfunctional, you go do a surgery, you're more than likely going to end up on the other side with pain.
Absolutely.
Right? So taking a step back and then really working with somebody who's skilled, physician and PT, to identify like what are all the other strategies we're going to put in to help change tissue integrity, to help change muscle and create more permanent changes by doing that versus going under the knife. I have some
horror stories.
Yes.
Yeah. So I will tell you, I see this, and this is the importance of having like a multidisciplinary team like you and I working together. I've talked about estrogen, how it affects the pelvic floor muscles on a earlier podcast. So check that out because I go into the science. But ultimately, it's really important. Sometimes, yes, you will find that there are defects in the pelvic floor that need surgery.
Correct.
But if you can work on strengthening before surgery and you can optimize the hormonal milieu, you're going to have a better outcome. And ultimately, that's the goal, is to be comfortable. And again, what is the goal, right? To enjoy pleasure, to feel good. Those are the important things for yourself. And so you have to decide if that's actually an issue or you just feel self-conscious about it. Again, that's fine to have body issues. We all do, many people do, but ultimately figure out what your goal is and what you want it to be, because you don't want to do something that ultimately results in pain and then you're then being regretful about that treatment decision you made.
Yes. And then in some cases, surgery is warranted, for example, right? So say you have stage 4 prolapse, you have to have surgery, right? Yeah. I mean, you have to. There is pelvic floor PT is not going to be your solution. But what I love to challenge all the physicians out there and the surgeons is prehab your patients. Send them to pelvic PT first, because your outcomes are going to be that much better. And then we'll rehab them at the other end, once they're surgically cleared.
Recovered.
Yeah. So,
In terms of sex, since we're on the topic.
Yes.
People are told to do Kegels for better orgasms, to have a higher semen volume, to have just more pleasure. In a person who has a normal functioning pelvic floor, will they see benefits in terms of just optimization? Say they're normal, they're healthy, they want to optimize their sexual function. Is this a good idea?
Yeah, if the pelvic floor is normal and healthy, then absolutely. I actually always say too, particularly for women, every woman over age of 40, number one, should have a vibrator, because we're after also blood flow. And then we're after like the muscle again, once that blood flow is there, then being able to utilize that to really fire and create good force. So you have two of your pelvic floor muscles that are on the outside that go up for with women to the clitoris itself. They're on the hood, okay, and they attach there. So part of their job is to help with orgasm, right? They need to be able to move through their full range of motion to also lengthen, right? So like the hood can retract back. Okay, they carry it's called the dorsal nerve. It's part of the pudendal nerve, runs up through that region. So if they again, you don't have normal good blood flow coming in there, if they're too tight, they're not quite, or they don't go through their range and they're not strong to create compression around the dorsal vein that's also running up through there, your orgasms are going to be compromised or maybe non-existent. Yes. So yes, I think it's really great. And so, but I always love to say it's all about blood flow. So get the blood flow there first. And if you don't want to use a vibrator, whatever, cardio, anything, right? Get blood flow in through the region and then take that muscle in through its range of motion, contract it, make sure you release it before you're going to contract it again.
Yes, there was actually a study that looked at orgasms versus pelvic floor muscle therapy, and they found that having orgasms, because an orgasm is essentially an involuntary pelvic floor muscle contraction at a rate of 0.8 seconds, or there's a cycle, right? And so it's doing it involuntarily. You don't have to actually actively contract those muscles. And so they found that in and of itself allows for strengthening of the pelvic floor muscles. So yes, I think it's great. And I always caution people that if you have any sort of pain, any sort of discomfort, stop, because there may be something else going on. You may have, assessed your pelvic floor incorrectly, and you don't want to worsen the problem.
Yes.
And then, the other thing you mentioned, how having poor blood flow and poor muscular blood flow can actually compromise orgasms. But what about when you're having dysfunction? So men will see it as erectile dysfunction. So how does your pelvic floor play a role in that?
It's the same concept, right, with men too, because we have these other muscles, the bulbospongiosis, ischiocavernosus, right, that play such an intimate relationship. And so those muscles still, ideally, they need to be able to start working through their full range of motion. So it becomes like a neuromuscular response. And that's where I do like, training to take the pelvic floor, get it used to going through that range, both, if it's so offline and you're normal with the resting state, then we may need to do some other things to like wake that up a little bit. And we know, again, there's overflow from other muscles that can continue or that feed into the pelvic floor, whether male or female, whatever gender, it doesn't matter because it's the same process, right? But I always love to tell, because people are just like tight. And I'm like, but remember, lengthen before you strengthen is one of my favorite sayings. Lengthen before you strengthen, right? Even if you don't walk around with a hypertonic pelvic floor, if you had a stressful day, it might be semi-contracted that day. And so just lengthen it, right?
Yeah. So do all those lengthening exercises we talked about. And then yes, using these exercises can benefit you. But if the muscles, what I tell people is when the muscles get too tight, they can actually compromise the blood flow to the organs. And I think that's really under-recognized, particularly in the general urology community, is that you can have erectile dysfunction because of pelvic floor dysfunction. And so I will see it very often in younger men who are, there's always like, whenever you have problems with erections, there's always a brain component because it stresses you out. It affects your thoughts and it affects your ability to focus on pleasure and focus on the actual enjoying parts of sex, because you're stressed about if your penis or your vagina is going to work the way you want it to, or your clitoris is going to work the way you want it to. So there's always that. But if your pelvic floor is tense, that can be the cause of the sexual dysfunction.
100%. A good analogy I also give patients is I'll ask them to make a fist like this. And I say, okay, look at your knuckles. What's happening with them? They're like, oh yeah, they're white. Exactly. Because there's no blood flow coming in, right? And they're short like that. So again, that you're not getting blood flow, right? And so, and anything coming through this, by the way, like if I'm a nerve, if I'm an organ right here and I'm squeezing down on you like this, is that going to be healthy? No, right? The nerve now can become compromised and it's like, oh my gosh, I'm irritated. So yes, love that.
So we talked about support. So, we talked about stability already, sort of. We talked about sex. Now let's talk about support. So you alluded to it already, that weak pelvic floor will lead to maybe bladder leakage, will lead to pelvic organ prolapse, which is a herniation of the vagina essentially, and the organs behind the vaginal skin that are sort of pushing down. But what about in men? How can they know they have a weak pelvic floor?
We have seen, believe it or not, with men, particularly heavy weightlifters, where they have ended up with prolapse. Sometimes because you can you see it.
Of the rectum.
Of the rectum literally protruding out through the external anal sphincter in severe cases we've had. And they're all, I have this foreign object sensation, right? And they don't know what it is, right?
Yeah.
And we're like, oh my gosh, right? So that's the wall, right? And now the organ that is following it down and out. So number one, if you see anything abnormal, okay, coming from any orifice, that's not normal.
Yes.
Number two, a lot of patients will also feel a heaviness. So they'll walk around, they're like, oh, I feel this heaviness. They may not correlate it with their exercise or some kind of activity, but there's pressure and there's heaviness. And one of the ways I always try and figure out, like, is this related to prolapse, right? Or an organ descent, or is this actually a pelvic floor muscle problem? Because if you have a hypertonic pelvic floor, you can get heaviness too. So I'll have a patient just lay down and I have them test this at home. I'm like, when you feel that symptom, then I want you to lay down and I want you to tell me within 5 minutes, is that better, right?
Yeah.
So when you're flat, gravity is eliminated.
So
right?
the
Or
weak
even
pelvic
legs up
floor
on the
should
wall.
go away.
So if prolapse is there and you just, now you're down and flat, right? And that helps it decrease. And they're like, oh, it's so much better. Then I'm like, if it's a true muscle spasm, laying down isn't necessarily going to immediately take it down that fast.
So why are these bodybuilders getting weak pelvic floors?
Because they have intra-abdominal pressure that's exceeding what is happening down lower with the pelvic floor. So it's like that pushing or, straining if you go to the bathroom, that breath holding that's happening. Even if they're not breath holding, they don't have strategy down low to combat what is happening up higher with the heavier weights. And they have to train specifically with the whole system online and back up a little bit, work with a pelvic floor PT so that it is happening the right way, like neurologically, right? So, and in the right sequence.
Yeah. So in those cases, sometimes just breathing correctly is not enough. They'll need more.
Right. Yes.
Yeah.
So what we'll do with a lot of athletes too, like if we find dysfunction of the pelvic floor, is we will train them like in behind closed doors too. Like I will actually feel what's happening with the pelvic floor during the activity. I'm like, all right, stand up, right?
Yeah.
Like not everyone's comfortable doing that, but it gives us so much information and and it's functional.
Yeah.
And then we can neurologically help, right, with different techniques on getting that muscle to fire appropriately.
So say someone wants to become a bodybuilder, right? Like
Yes.
what can they do? Is there prevention? So we talked about breathing, right? We talked about doing lengthening exercise. What else? Is there anything else they can do?
That comes up to you utilizing, making sure that your biomechanics are right. And that is going to take like working with a professional where we're going to analyze, like say, your foot collapses, right? You're flat footed or whatever. So, and your sport requires you to be able to load in standing, right? And be able to also like push off of that effectively. Well, that flat foot, there's going to be compensation all the way up through what we call the kinetic chain, right? So the tibia, the bone in the lower leg and the femur start to rotate in, and then your pelvic floor is always cheating. So I think you've got to get a detective on your case and make the time, find somebody who has that expertise to really analyze like for you and your activity, your sport, what's happening, and then help teach you new strategy.
So sometimes it just requires you to find some help. So how does someone find a very good pelvic floor physical therapist like yourself?
Awesome question. So multiple ways. Number one, I always love to say, just Google pelvic floor PT near me.
Yeah.
Okay. And then you want to see who shows up. Number two, and then even then there's specialties within pelvic PT. So some pelvic PTs will specialize more in pre and postpartum and pregnancy. Other PTs will specialize in pain, others sexual dysfunction. Some will treat it all, some with the female athlete. So match up what your problem is with a PT that has specialty in that issue. Number two, after Google, there are different organizations. So the American Physical Therapy Association, you can find a provider if you go on apta.org. And then it's the section of, so Academy of Pelvic Health now. And then you find a provider who's a member and you just type in your zip code. There is the International Pelvic Pain Society also has a good database of pelvic PTs and MDs who deal with pelvic pain. That's pelvicpain.org. So there's pelvicrehab.com is another good database. There is my friend Tracy Scher, who started Pelvic Guru, and she has the Global Pelvic Alliance membership program of all providers across the world can register with her. So there are multiple sites. There should be no reason why, honestly, you can't find somebody. But if you live in part of the world where there isn't one, because we still don't exist everywhere yet, then find somebody that offers good telehealth. Find, somebody that you can work online with, because that's better than nothing. And there's a lot that can be accomplished that way.